Namaskar everyone, my name is Dr. Manish Yadav and we are on a journey of understanding Burnett series and especially the thinking process of Burnett through his case understanding. And today I'm here to share you with a very small case. In fact, it's a very small case and very short case, in a way easy case you can say, but there's definitely something to learn from it. And I was really happy to go through this case. This case gave me a confidence that even sometimes, the tumors come, a growth comes, or pathological case come. It may sound very serious, it may sound very threatening, but simple understanding, simple remedies with minimum prescriptions, we can definitely get some great results. And this case is one of the examples of it. So people who have been watching my videos since beginning, from where we started the Burnett's philosophy, then we talked about his ladder pattern series and different cases. I have been showing you the thinking pattern and the process of it. If you have gone through that, then this case is going to be very easy for you. Okay, so let's go ahead and let's analyze this case. Let's try to learn something beautiful out of this case so that we can use it in our practice and it can help a lot of people around who are suffering. So just you have to give me 2 minutes. I'll share my PPT. Okay, great. So this case is a case from Burnett's tumor book, Burnett's tumor, chapter number 19, tumor of right side of breast. So there's a lady comes with the right side of breast, and let us see how does he manage. The entire purpose of doing these cases is I have been very fascinated by Burnett's approach and also Hahnemann's approach. And I see a lot of clarity, a lot of similarity, and a lot of clarity in his mind when using this method. So I have spoken it about in different cases also. In the same case, I'm going to touch more aspects, deeper aspects of this in this case. So May 2nd, 1889, 39-year female came, spinal deformity. She was already having a spinal deformity all her life. And she was wearing a kind of instruments to stabilize her since she was 12 years of age. So she's right now 39. Around when she was 12 years of age, since then she got deformity and she's wearing this instrument. Now, the first question that should come to your mind, of course, this is a case of right breast tumor. We're going to address the tumor. But the complaint for which patient has come to you, many a times that is not the real complaint. Hence, it is very crucial to go back in the past history and find out the evolution of disease from where the disruption started. What you see is just the product of the disharmony and dysfunction or the trouble inside, disturbance of the vital force. It is shown in signs and symptoms or maybe in the pathological condition. But the disease is something else many times. And this was a disease, what Hahnemann actually talked about in chronic disease. And that's what Burnett continuously tries to find out. There's always a soil on which the present totality is formed. To get perfect cure, it is very crucial to understand the soil and to address it step by step. So she has a spinal deformity at such a young age. It means definitely there is something in the background, in the past history, in the family history, and that has to be addressed. With whatever method you come to the remedy, you can give a constitutional remedy, you can give an indicated remedy. Along with that, you have to go back and address the soil. You have to cure it. Now you can see, father died of phthisis, tuberculosis. 2 brothers, 2 sisters also died of tuberculosis, and 1 brother died of typhoid. Now are you understanding? And this information is so important, so important. This observation you can still find out in your own practice. I have found out many cases when at young age there's a pathological case or there's a structural deformity happening. It cannot just come like that, right? There has to be something in the background, and especially past history and family history. So the disease is being running through the ages, through the families, and that is the disposition. And that disposition creates disease. So hence it is said, if you want to cure a disease, just annihilating the symptoms, removing the outgrowths is not the real cure. The disposition has to get cured. And in this case, what is the disposition? Tubercular disposition. We can see tuberculosis in the background from family side. And Burnett says that typhoid, like one of the, who got, one of the brother also died of typhoid. So it is his observation that he says, I have often noticed the proneness to typhoid in those disposed to phthisis. So people who have got, he's seen in his practice that people who have tubercular taint, tubercular disease, or tubercular background, there is a great disposition to fall into typhoid. They will have many typhoid fevers. Like we have got remedies, complaints after typhoid, carboveg, phosphoric acid, typhoidinum, we can use it. But if a patient is getting typhoid, there could be a chance you can go little back and trace, and in few cases, many cases, probably you can find out, this is his observation, but we can still find out what is exactly the disposition. So tuberculosis is one of the disposition, at least in this case. But yes, as we know, we don't stop at one. So past history, what are the illnesses he has spread? He has suffered from rheumatism. He suffered from neuralgia, measles, okay, whooping cough. So again, you see, there's a tubercular background going around, right? Now measles, basically measles as an intercurrent, many times you will see MMR being used. We can use in later part, as a nosode. Rheumatism, neuralgias. Neuralgias are also part of tubercular diathesis. Now rheumatism can be psychotic also. But yes, if so much tubercular base is there, then definitely tubercular miasm is very high in this case. And that is the nosode that we all have to think about. So a simple case. So let's start the treatment. Chief complaints. What are her complaints right now? In the upper aspect of her right breast, between it and the axilla, there is a tumor of about the size of my pretty big fist. So it's a big tumor on the right hand side between the right breast and the axilla. Big tumor, okay? Other symptoms are frightful headaches, right side, coming on midnight and going off daybreak. Now, what does it suggest? I'm just giving you a hint, of the prescription. Headaches, okay. Right side, okay. Modality, coming on midnight and going off daybreak. Night aggravation, daybreak amelioration, syphilinum. Comes in daybreak, and better in the night, medrinum. So tubercular diathesis has SORA and syphilis combined together. So whenever you're thinking of tubercular diathesis, syphilitic symptoms will predominate sometime, or it will lurk in the background. Soric symptoms are also there. SORA is always there. So you have to intervene with antisorics in every case, I think. That's what Hahnemann said. But yes, syphilinum is another remedy that you can think of. Severe, very severe dysmenorrhea of all her menstrual life. But till last 6 months, it has been a good deal less severe. So all her life, she has been suffering from dysmenorrhea, which is also neuralgic in nature. And yes, last 6 years, little better. So now you can connect this, right? Last 6 years, I said 6 months, it is better. Now, menstrual complaints are actually, they are general symptoms. Now you can see when females' menses are proper, the other symptoms do not come. And when menses start deteriorating, or flows, there's something changes happening in the, like this lady was having dysmenorrhea for such a long time. And suddenly without any medication, the female trouble is reducing. That's how disease is traveling to some other part. So all these aspects, you see a tumor, you see a headache, you see a dysmenorrhea. So now what we can do is that we can take the totality of tumor, we can take the totality of headaches, we can take the totality of dysmenorrhea, and we can give the remedies, which will definitely work if it is done properly, classically. But the question has to be asked, from where it is coming out, from where it is erupting. What is the miasm? What is the disposition? A fountain, when you see a fountain has got one source, but when it is coming out, it has so many streams. The streams that you see is the totality. The streams that you see is the symptom. The stream that you see is the pathology. But from where it is coming, what is the breeding ground? And that breeding ground is nothing but the miasm. In this case, the miasm which is predominantly causing this disposition of the soil is tubercular base. She thinks herself that a tumor started. Now, this is what patient said. Tumor started from the pressure of the fingers of the person who fits on her mechanical arrangement of the support. So the instrument that she fits in the spine, so it requires like, some pushing. So the lady says maybe it is because of the person who is fitting, the pressure of the fingers comes on the chest and the breast sometimes. This could be an injury component, could be a empty speculation. If it is an injury, if you take that as an injury also, then Belispar, Conayam, these are some remedies that can come to your mind. But now we can take it, we can think about it later on, because we still have got some really good remedy indications. Of course, she was advised for a surgery. What else? Patient, I should say, she was a huge salt eater. Now, salt eater, people who crave for salt. And there are remedies, for salt eating. Remedies like natrum muriaticum, phosphorus, right? You can search more. Many blotches in her skin, many blotches, blotches in her skin. Now, when skin condition, you see some females, a lot of blotches are there, a lot of pigmentations are there. You give so many remedies, but nothing happens. She applies so many creams, nothing happened. Those blotches, which are adamant and obstinate, are many times signs of indications of internal turmoil, the internal miasmatic state. And you will see in this case, once the anti-miasmatic remedy of the nosode indicated was given, the blotches in the follow-up reduced considerably. So a hint for you, females who come for marks, blotches, so you can go back in the past history and find out the disposition. Of course, what's the remedy? It says, to my mind, the constitution crisis of the lady was tubercular. So her Burnett's favorite, Basilinum. So he said, tubercular base, everything is tubercular. I would go with Basilinum. So he starts with Basilinum in rather frequent repetition. What happens now? Now, this is very crucial, okay? You have to understand this, that whenever a nosode is given, and if it is really similar, or similarity is there. See, the philosophy of homeopathy is individualization and law of similars, right? Even if you're talking about miasmatic prescriptions, there has to be law of individualization and similarity. It has to be there. Ultimately, we are giving a remedy only, right? So whenever you give anti-miasmatic remedy, I say to this, and I've seen in many cases, the patient remains dormant. After you give an indicated miasmatic drug or nosode, something happens. Means some symptoms erupt. Maybe it goes and excites the vital force and symptoms come up. So that the symptoms come up and it becomes very important, very easy for us to take the totality and give the. So what happened here? Similar thing happened. Pus has evidently formed in the outermost part of the previously hard tumor. So now the hard tumor is forming abscesses. Headache is worse at the night towards morning. Headache persists. So definitely she will require citylinum. Maybe you can give it right now, or maybe you can give it later. But right now, as the pus is formed, so we have to do something with the breast tumor. Headache we can tackle later on. There are fewer cutaneous blotches. She tells me she is liable to severe pain in the ball of the left foot. Worse approach of damp weather. So she says, I get a pain in the left foot, the ball of the left foot, and in the damp weather. So she is kind of a chilly patient. Dampness aggravates her. And what a wonderful location, exactly only at the ball of the left foot. Last period more than usual painful. As you saw this, what happened? The old symptom came back. She was having dysmenorrhea for so many years, and last 6 months dysmenorrhea settled down, and then her trouble started, headache and breast complaints. But now once the indicated remedy is given, her dysmenorrhea started. That is in a way good time. She retches a good deal. So there's a lot of nausea. So our basilinum has definitely touched the sensitivity and done something, some turmoil it has created, and we have got some beautiful symptoms. Now, only thing is, we have to repertorize, we have to find out materia medica wise, find out the. So now looking at this, of course, the remedy that he gave, the indications of the remedies are not there basically, right? But I have attempted a little bit to find out that if this was my case and to find out that remedy, how I would have approached, because I'm a person who uses repertory and materia medica both. Okay. So definitely I need a remedy which has got action on the breast tumor, which has got like the breast tumor in that stage where it is suppurative in a nature. Okay. Tubercular base has to be there, and wall of the left foot. That's a very good specific location. Now, patient comes and tells you, I get only pain in the left wrist. I get only pain in the right jaw. When they say like that, the location becomes very important. So location, sensation, modality, and concomitant, I will find out, go in repertory and see in different repertories where I can get exact location of it in a way. Okay. So you can use cant, you can use BBCR, Boger. These are the repertories that you can use. So I searched in all the repertories, but I was not happy with it. And I came to another repertory, which I'm going to share with you. And of course, dampness aggravates and chilly in a way. So what I did here is that, okay, so let me share this with you. Allen's repertory. Now, we have different repertories, and repertories are very good. Very good. It helps a lot. So we have got BBCR, we've got cant, Fatak. These are some wonderful repertories. Even Boger, I don't use much Boger, but these three repertories and Clark, Nair, these are 4 or 5 repertories. I take a lot of help. But Allen's repertory is a wonderful repertory, and I have used in some of the cases where scarcity of symptom is there, or I'm not happy with the remedy, not matching. It is. Please remember this, that the going into repertory is not to form totalities. You go into repertory so that you come to the materia medica part. So different repertories are different rubrics, maybe same rubrics in different repertories will indicate different remedies. Your idea is to look at the remedies, not at the rubric. So I retrospectively, I was looking for the remedy. And Allen's repertory, I can tell you, I can share you many cases, but I'm being very fortunate to work with Dr. Sarkar for so many years. And there were some really wonderful cases where Sir gave some remedies which we cannot think about, like in a case of a tumor or throat cancer. So many cases I have seen where he used to quote that this remedy, this symptom is written in Allen's encyclopedia. Allen's encyclopedia, Allen's encyclopedia. And I used to wonder that how he goes into Allen's encyclopedia. It's like, the entire drugs are given, like proving symptoms are given. How does he find out? And then I came across Allen's repertory. This is a repertory which can really help you. In some of the cases, it can really help you. You can go and find out the rubrics, look at the remedies, and the remedies many times matches. And in some of my cases, it has really helped you. Now, what about this case? So if you go in Allen's repertory, Allen F, it is alphabetic repertory. So you go in F, foot, back, ball off. So it is written ball off foot, pain. Not left, right, but just the ball of foot. So you can generalize it. Like Kent used to say, you generalize, don't become more particular. So we generalize it. And there are only 3 remedies: alumina, merc IR, and silica. Then we go down, tubercular disposition. So how to take miasmatic rubrics? Sometimes people ask, oh, how to take miasmatic rubric? There are so many remedies which indicate miasm, right? Yes. So in Bonninghausen, if you go, you will get psychotic, psoriatic, syphilitic. And when you go and look for joints, because why joints I took? You can see tubercular joints. Now in this case, we are treating her breast tumor, but look at her back pathology. What is first affected? Her joint. The spine gave up. The spine got affected. When spine gets affected now, in tubercular patient, it is tubercular joints. So I took a rubric, Bonninghausen generalities, tubercular joints. And now in the back foot also that I'm taking, the joints are affected. So joints affected with tubercular background. So you can take tubercular joints as a rubric. But yes, there are rubrics like tubercular. If you get, you can take that. And then pus formation. So my remedy, whichever remedy I choose, I should have all these 3-4 factors into it. It should have pus, it should have the location, it should have the modality, and tubercular base. So when I repertorize Allen's, I take this rubric from Allen's. I take this from Bonninghausen, tubercular joints. I go to Kent and take generalized, now abscess. What is the problem here? Her main problem now is there is mammae and it is now suppurating. So abscess mammae, there are 18 remedies. I took it in Bonninghausen also. Similar meaning. There are 8 remedies. So I'll combine both of them. Okay. Generalities, whenever I have to take aggravation, amelioration, BBCR is one of the beautiful book repertory. So I went in generalization, damp dwellings begin in. So means damp aggravates. And when you look at, this is what totality you get. Silica, phosphorus, merc, phyto, hepar, sulfur, sisters, belladonna. And yes, you can differentiate with the help of your knowledge of materia medica. And here the remedy that was chosen was silica. The remedy that was given was silica. You can just get a screenshot of this. And which is one thing which is also very nice here. If you see here, silica 6, generally used to prescribe low potencies. 5 drops in water 3 times a day. Water dilution. Hahnemann, in his 6th edition, started talking about not giving dry doses, but giving water dilution. So for faster recovery, faster relief, the remedy that you give in water dose acts faster than you give in dry doses. So try out. I give a lot of patients are there. I give water doses and its results are really good. So silica was given on this basis. Now let's go ahead. What happened after this silica? June she comes 27th. Patient feels much better. Headaches better. No retching. Tumor smaller, not so active, no longer looks so red. But the tissue in its inside has evidently softened and the contents will clearly have to be voided. So it is softened, but there are some content which he says has to be removed. So once the patient is doing better, what should he do? He should wait. So what he did, he repeated. First prescription means he repeated the same prescription, continued silica. After that, what happened? Tumor burst. The tumor has burst and discharged enormously. So tumor got burst open and started discharging. Now this is a very critical situation, But when generals are better and discharges are happening, you're on the right track. After that, so tumor problem is now resolving, but again, bad nights, want of rest, nocturnal headache starts. You know which remedy now. And now our syphilinum comes in, which I have already explained to you. Syphilinum, night aggravates, and daybreak amelioration. I should have said that the patient's friend declares she looks 10 years younger. Indeed, she has a freshness of tint, healthfulness of face that no one remembers to have ever observed in her before. And then 27th July, tumor is practically gone. Patient is well in herself. But I again ordered silica to get rid of hardened tissue. There is tissue which has got fibrosed around where the abscess broke. Hardened tissue, there's one more remedy which comes to my mind is thiocinaminum, graphitis. These are few remedies, hard cricket traces. We can use it after, in conditions of fibrosed tissues. So yes, silica worked here. So why to go to another remedy? He started with silica and patient made complete recovery. Tumor totally disappeared. And for the first time in her life, she feels in a capital health. The cure made a very deep impression in the patient's social circle. And if you see here, it was started in May and 27, maybe 2.5, 3 months, the entire tumor gone. So it was a wonderful case, and as I told you, it is a small case, but there is so much to learn out of it. What I was thinking about this case was there was some rheumatism, neuralgia, measles, also there in the practical, past histories. But yes, as the patient is doing well, I could have thought of maybe if not psychotic was not clear, but from my understanding, I would have ended the case. This is what I am telling you, what I would have done. Okay, Burnett is master, everybody's master. Wait, we also have to develop our own thinking. If it was my case and doing so nice, I would have ended the case with anti-soring. If she was chilly, I would have given sorinum. Hot, I would have given sulfur. 1M or 10M, few doses, and that would have ended, because everything starts with SORA, ends with SORA. SORA is in the background always. It has to be tackled. It has to be touched. So with this, it was, I hope it was, you enjoyed this case, a short and sweet case. So guys, look at different repertories. Whatever remedies there, match the Mater Medica. Aim at matching the drugs in the Mater Medica MM. Okay, Allen's repertory, try to explore Nair, Clark, UPCR, Patak, wonderful repertories. But these repertories are only a guidance. Mater Medica is very crucial. And yes, don't forget to go back and find out the miasmatic thing. The miasmat, the nosodes, the zoic medicines will cure your disposition. If you really want to have a cure can happen only when disposition is touched. Totality, remedies touch, many times cure happens, but it is only because it is also touching the disposition. So look back, go back and find out the inherent cause, the miasm, take proper case, proper understanding, and I'm done with it. So thank you very much for today's session.